I was the administrator for Consumer and Marketing Services, which was a new agency at that time that was dealing mostly with food policy and food safety. As administrator, I had been invited to a meeting at the Public Health Service for the Women and Children's Bureau, and they operate health clinics in urban areas, particularly inner city neighborhoods. The meeting had been called to let doctors and nurses from clinics around the U.S. discuss the current set of problems that they were dealing with. And the major problem at that time, this would have been in 1966, 67, were mothers and infants and small children coming into the clinics with various diseases, illnesses, none of which could be treated medically. It was just physically conditions that the symptoms could be dealt with, but the underlying problems were malnutrition. And the doctors were concerned about it, and I had asked if the lack of food was a problem, why didn't they prescribe food? And they said they didn't have the budget to do that. I suggested then if the Department of Agriculture could set up commissaries within these neighborhood clinics and stock them with foods that the doctors would in effect prescribe. Would that help? And of course they said yes, because that overcomes the big financial barrier. So I had gone. I went back to my office and pulled the staff together and discussed whether we could stock the clinics, whether we could build the clinics, design and build the clinics, and it became evident very quickly that we had the authority to do that, plus the funding for the food. And we set the program up then as a demonstration with, I forget at the time, 10 or 12 commissaries located in various urban centers around the United States. So that was the first WIC, the first phase of the WIC program. One of the things that we did in creating the food policy in the United States that's essentially what we did in the 1960s. Was to define hunger in a way that you could develop programs then to address it. And we defined hunger as a condition of affecting individuals in specific social groups, families, children away from home in schools, and mothers and mothers and infants and young children up to age 5. And all of these are groups that have very specific and very distinct hunger problems or hunger issues. Families, they're all related to poverty, but families without food stamps would go hungry. I mean, look at what we have today, where we're spending almost $100 million on 85 to 90 billion dollars on food stamps. There are 40 million Americans today that are participating in the food stamp program, and you can imagine the hunger conditions that would exist now if we didn't have the food stamp program. Child nutrition programs, the school meals. We've got 30-some million children in schools that participate daily in school meals, lunch and breakfast. We're spending $14 billion a year there. And on WIC we have, well, almost 8 million children and mothers, children, and infants. And I think the cost is close to $8 billion a year. When you look at the particular situation that mothers face, it's very different than what we think of in terms of child nutrition. This situation was sort of in the back of my mind when we got the program going. Is that if you look at conditions where famine exists, one of the hallmarks of famine is the struggle that mothers have to try to ensure the survival of her children. And the studies on famine all find examples of this situation where the mothers will sell almost everything and do almost everything to ensure that their child has enough to eat to survive, so that if we're going to have a program that deals with the problems that were evident in 1965, 66, where children and mothers were both malnourished and were ill because of lack of an adequate diet, that there's a responsibility that we have as a society to assist at this very significant period, because from infant to up to age 5, the child is most vulnerable because of lack of food, most vulnerable because the brain is growing at a much different rate up to age 5 than it does after that period. So for all of these different reasons, the WIC program fulfills a social responsibility that can't be met by any of the other food programs.